Hi again, Ohad Hershkovitz here. So this is the third and final overview video on treating trichotillomania, and this one will focus on behavioral therapy. So we have a couple of goals in the behavioral aspect of CBT for trichotillomania, as well as similar disorders such as dermatillomania, nail biting, and tics. And as we discussed in the initial video, one of the causes for the impulse to pull is inadequate release of tension that builds up in the body. And so we want to make sure that the patient has better mechanisms for relieving tension. So we want to do an evaluation of what kind of tension relieving behaviors they have on a regular basis before therapy, and then we want to help them develop more proactive and regular tension relieving behaviors after therapy, which might include relaxation exercises, which might include more active or energetic behaviors such as sports or walking or arts or talking about issues more. And our goal here, there's obviously many different types of behaviors, but our goal here is to have the patient accept that there is tension in the body and do something about it proactively instead of having that tension build up over time without them noticing until it causes these impulses to micro-relieve. And so that's one of our goals in the behavioral therapy, to create a healthier lifestyle of tension relief. Now we can also give them behaviors to address immediately the hair pulling. One of the behaviors that we would give them is alternative behaviors. So when they notice their hair pulling, what else can they do to relieve tension in that moment? Perhaps take a stress ball or go outside or take a stick and hit a tree, listen to music. What else can they do in that moment? These are replacement exercises instead of hair pulling. And we can also give them behaviors to directly challenge the hair pulling. For example, in HRT or habit reversal training, we directly try to interfere in the behavior for hair pulling. For example, giving the patient ideas such as wearing gloves during times or places where they're more likely to pull, or putting oil on their fingers or a band-aid on their nails so that it's more difficult to pull, or doing something else with their hands which directly interferes with their ability to pull. So these are interference behaviors which might have a less of a therapeutic value long-term, but can help immediately stopping the behavior in the short term, while the other behaviors I mentioned earlier can help them relieve tension so as not to reach that point of emotional tension build up and decreasing the tension. So that's the behavioral overview. I hope you've enjoyed these 3 overview videos on trichotillomania and associated disorders. Of course, I'd love to hear your questions or feedback. You're welcome to enter them in below. And don't forget, all these videos and more discussions are available in our therapist community at social.cbtnest.com. So if you're a therapist, head over. It's free to join. Hope to see you there.